So V-beam is a pulse dye laser. It targets red vessels in the skin. So someone who has rosacea, little telangiectasias is what we call them around the corners of the nose, little angiomas, those are little red dots that can appear on the skin as years go on. And then under the eyes, I know you were a little bit concerned about the red. When I push on it, I can see that it actually blanches and then comes back to a nice pink color, so that tells me it's vessels underneath the skin creating that and not a brown pigmentation on top. We can bring that down with a series of treatments with the V-beam. It's going to be a really bright light and a cool spritz. You'll feel the laser, it feels like a little elastic band. It's not very strong, and then you'll feel a little flush of spray which helps cool the skin. This laser targets red, looking for that color in the skin. It starts breaking down the vessels in the wall, and over hitting it a number of times, that vessel cannot rebuild itself. Red always wants to come back, and it's different for everyone. Some people come back in a few months, some people come back in a few years. I've seen some people go from really, really dark red to a very neutral, natural color on their skin with a series of treatments. And I've seen other people just treat a couple angiomas and it goes away in a couple of treatments. V-beam is also really effective for scar treatment. When the scar is still red and you can blanch it, you push on it and it flushes back to red, we'll treat it to get rid of those vessels, and what that does is help smooth out the scar tissue so that you don't get that raised up white bump that creates a very visible mark on the skin. So now that we've finished the treatment, I've applied the cooling gel onto your skin. That'll just help keep the temperature under control. If it starts to warm up more, just put a little bit of ice on it, just some cool packs. Don't hold them on for too long, but just help to tone down and bring that temperature down. It looks really good. I don't anticipate any long-term warmth or discomfort for you at all. I think you'll have really smooth effects here in the next little bit, and we should probably see you back in about 5 weeks to continue our treatment.